Hey y'all, Sean Starker here. Hey, have you guys ever tried to put yourselves into the perfect posture and find out when you get there, like it's really uncomfortable, it feels unnatural, in some cases it's just painful, and in any case, when you let go of your effort, you just sort of sink back into that regular posture that you had before? Well, if that's the case, then you might have something called a muscle imbalance that's affecting your posture. To understand what a muscle imbalance is, we're going to have to put our thinking caps on and go back to school. All right, class is in session. The best I could do on short notice was this here thinking sombrero. So we're looking at muscle imbalances, and one of the most common ones is the anterior pelvic tilt. So we'll kind of take a closer look at that. And don't get confused or hung up by the terminology. Just it's a tilt of the pelvis anteriorly or to the front. So it's kind of named for exactly what it does, and it looks like that. If you've ever seen anybody that has like a Kim Kardashian butt and then the mid back is a little locked up, it looks kind of uncomfortable because it is. Like all muscle imbalances, an anterior pelvic tilt is simply a combination of some muscles being weakened while some muscles are tightened, and in neither case are they playing well together, so they're not integrated very well. If we look at the tight team over here, the muscle groups that are tight are the hip flexors, and those are the muscles that are just right in the pocket area, so right at the thighs. They flex the hips. Pretty simple, right? Now, the lats are also tight. That's one of the largest muscles here in the body, in the upper body, rather. And if it's tight, I mean, it's going to cause a problem already just based on the fact of how large it is. But if the lats are tight, these big V-shaped muscles, then they're going to really assist with locking that mid back up. And the third group are the spinal erectors. Those are the muscles that run parallel to your spinal cord and help keep you upright. So, looking at the weakened side, those muscles that need conditioning, those would be the abs and then the glutes or that dunk. So you got to get working on that bubble butt if you want to counteract the effects of anterior pelvic tilt. Now you're probably wondering where anterior pelvic tilt comes from. A lot of times it's in people that sit for long periods of time, but that's not always the case. So just because you're seated doesn't mean you're going to be automatically susceptible to an anterior pelvic tilt. A lot of people that stand but have their knees locked, so a lot of the attention is on the joints and not the muscles, they'll quickly go into an anterior pelvic tilt. So you don't have to be seated to get it. But in both cases, it is correctable. We're just going to do a series of a couple of movements. I'll show you examples of those in just a second here. We'll go down to the gym floor, get some light equipment, and do it. Okay, one of the first things we want to do is to stretch out some of the tight muscles. And this stretch is going to get 2/3 of those here real quick. So what we'll do is take a staggered kneeling stance. I got a cushion in case the knee starts to yell at me from being on the floor like that. And what I'll do is just lean forward. You can already see right there in the hips that the hip flexor is going to start to stretch out. So that's part of it. And then we'll just reach up like y'all grabbing some of that top shelf liquor y'all be drinking out there, that good Patron or whiskey or what have you. And just look like that. Stretch that 30 seconds, 45 seconds, a minute, whatever kind of time you have, and then go on to the next side. Okay, this next one's pretty easy. We're just going to lay down on the floor here, put the feet together, and you're going to use your abs to pull and your butt to push here. So it's just a simple floor bridge. Really easy. Losing my equipment there. All right, and so that's working some of those muscles that need to be tightened up here. And you can do a couple of sets of them. I'll put the programming down in the comment section so you guys know exactly how many of these you're doing and how long you're holding. And the last thing we're going to do is to integrate those muscles that we've just addressed. So let's do that last one now. Okay, this last move is kind of like the dude's rug. It just sort of ties everything together. It addresses the muscles that we stretch, the muscles that we strengthen, and it kind of it integrates them. It forces them to play nicely together. So we're going to choose movements that generally work the whole body. This is no different here. Squat to an overhead front delt raise. All right, I want to show you something pretty important here, that when you're doing these, you want to make sure that you go down into a nice squat. Okay, and then when you come up here, you're not extending into an anterior pelvic tilt. See how that can happen with the overhead move. We want to be pretty conscious of taking a squat, coming up here, and then forcing the hips to come in like that so that we're not in an anterior pelvic tilt, right? That would be kind of defeating the purpose. So just like that. And it kind of looks like I'm going the other direction, what they call a posterior pelvic tilt. And that's okay. If we're trying to work anterior pelvic tilts, that's kind of what we need to do. If you guys are looking for a complete program that'll take you step by step through what it takes to correct an anterior pelvic tilt, then head over to thehealthymovement.net and pick up our Sit to Fit Anterior Pelvic Tilt program. It's a 6 to 8 week program designed to take you through everything that you need to know to correct your anterior pelvic tilt, to help reduce pain, to help restore function, help get you guys living like you want to live.